Hello all. Good evening to session. Today we are going to discuss speech delay and developing speech in a child. Today our guest is Dr. Radha Rajpal, ma'am. She is a consultant developmental pediatrics pediatrician from Fortis Memorial Hospital, Gurgaon. She's graduated from Lady Hardinge Medical College. She has done master's degree in pediatrics and fellowship from Royal College of Pediatrics and Child Health. She has certificate in developmental pediatrics from LHMC. She has totally 18 years of experience in the area of developmental pediatrics. Good evening, ma'am.
Good evening. Thank you for the introduction, Dr. Narendra. I'm grateful to you for this opportunity.
Ma'am, today we will have a small question and answer session about speech delay and developmental speech in a child. Okay, ma'am?
Sure, I look forward to that. Thank you.
Okay, ma'am. The first question is, what are the red flags for speech development in a child?
So, a red flag is the developmental age at which a parent should start getting worried where the child has not achieved a milestone. So, to just go through the laundry list, at 9 months, if your baby is not babbling, if at 12 months the baby has not said their first word, if at 15 months there is not words like mama, dada, and papa coming along, if by the time the child is 24 months and the child has not put two words together like go out, want juice, ghumi chalo, things like that, then it needs to be worried. Also, subtle signs like if the child is not interested in communication, if the child is not making eye contact, if the child is withdrawn, if the child has a plateau in language or a regression in language, where you find that the child is not gaining words as quickly as other children his age, or the child has lost words which the child has regained. Also, things like drooling, if the child has articulation problems, if the child is not able to chew properly, and if the child is not able to pronounce words. If you are not able to understand your child's language by 24 months and strangers cannot understand your child's language by 36 months, then that is definitely a need to consult a pediatrician.
A very nice explanation, ma'am. You have said very in a brief and very understandable to parents. Going to next question, ma'am. What is non-verbal communication?
So nonverbal communication is a soft sign which becomes very important when we are diagnosing something like autism, because of course in adults they say 90% of communication is nonverbal, but in children it is even more so. So I would say gestures, imitation, facial
Yeah.
expression, body language, all these things constitute nonverbal expression. So if a child walks into my room and the parents are suspecting autism because the child is not talking at all, but if the child is pointing to things, if I do a high five and the child responds to the high five, if I smile at the child and the child smiles back, if the child is making good eye contact, then I would not be worried. So these are all signs of nonverbal communication which one should look for in a child where there is any kind of language concern.
It's like a reciprocal communication between the parent and child.
Absolutely, without words. Yeah, absolutely, without words. I think it's a lot between adults also. I think just by looks, we communicate so much to each other. So the same is with children. If the child is able to communicate a lot of things like lift their hands up if they want to be picked up, that is one of the first things around 10 months. The moment they get up from sleep, they put their hands up. Or if
Yeah.
they are able to do jay, or they are able to shake hands or do a high five, then
Yeah.
there is a sign that this child is going to develop language and is going to be all right.
Okay, ma'am. Next question is, what is the difference between autism and speech delay?
So this is a very important question, and a lot of parents are very worried about autism. They read a lot, before they come. So I just wanted to speak very briefly about the difference between speech and language. So what is
Okay, ma'am.
speech? Speech is basically a verbalization or an articulation of a particular sound. Whereas what is language? Language is the expression of an idea using a code. So it's just important to understand the difference between a speech delay and a language delay. So a speech delay, the child may not be saying words. It's like not what the child says, but in language delay, it is what the child says. It's not how the child says it. So in a language delay, the child may be saying a lot of random things like Humpty Dumpty sat on a wall at least 10 times and very clearly, but make no coherent kind of speech. So coming to the difference between autism and speech delay is, first of all, like we talked about, nonverbal communication. That is a very important sign that we need to look for, about eye contact, about gestures, about pointing, about the child having pretend play, having an interest in peers. The two pieces that I usually look for when I'm differentiating between speech delay and autism is the whole social piece. That does this child experience social warmth? Do they want to connect socially with other people? Do they have a need for hugs and tickles and reaching out to other people socially? The other
Yeah.
piece that I look for is nonverbal communication. So pointing, gestures, high fives, and also pretend play is a very important part of the whole thing. Then the need to socialize with peers is absent in children with autism. Their ability to play is absent. And the other thing that is routines and behaviors. So a child who is not able to communicate occupies their body with things which are of not of much use, like random movements like flapping and jumping up and down, nodding their heads repeatedly, having routines like lining up cars repeatedly, or being attached to inanimate objects, or being aversive to touch. So these are different kind of symptoms which appear in children of autism, which are not there in a child with speech delay. Also, another word about expressive speech delay and receptive speech delay. Expressive speech delay is when the child is not able to verbalize, but they understand a lot. They follow directions and they are able to point to things that they want. If you show them two fruits, they're able to tell you which one is the apple. Whereas in a receptive language delay, the child is not able to follow out directions. As they grow older, they are not able to hold a conversation because they are not able to understand what the other person is saying. When they read, they are not able to get the meaning of things. Understanding abstract concepts like justice, love, courage becomes difficult for them. So it's important to understand that there is autism and then there is speech delay. And within speech delay, there could be an expressive delay, a receptive delay, or there could be an expressive and receptive language delay. So it's important to know the nuances of that.
A very nice explanation, ma'am. We can understand by parents and the primary care physicians and budding pediatricians, so they can query the of doubts of the patients concern, especially difference between autism and speech delay, and in speech delay the difference between expressive and receptive delays. Thank you, ma'am. We'll move on to the next question. What is speech therapy and who needs it?
Okay, so in the field of development, any kind of therapy means any kind of sustained treatment. So, what we are planning to do with what we're trying to do with therapy is that we are trying to remodel the brain, and we are trying to create neuronal pathways where there were none. So like we know that this is the region which is affected in autism in speech, the temporal region. This is also the area which maps the thumb and the index finger, which is why these children also often have occupational therapy issues. So we are trying to remodel this area by giving a repeated stimulus over and over again so that neuronal pathways are created here. So in speech therapy, what we are doing is that in effect, we are talking to the child using books, using pictures, using toys, and using stories in order to create language pathways where none had existed. Now, the kind of speech therapy a child may require is it may be a language therapy where the child does not have language, or it may be an articulation disorder where the child speaks fluently but they're not able to pronounce certain words, like they say sure for sir and different articulation issues. So that would be a phonological treatment, and that would be different from a language therapy. So I would just like to say a word about floor time, which is normally what I use when I'm working on speech with children. So floor time is a form of therapy which can be used for anything, for gross motor skills, fine motor skills, for speech, and for language development. So this contains 6 stages. It was developed by Dr. Stanley Greenspan, and the 6 stages are self-regulation, then engagement and intimacy, then two-way communication, complex communication, emotional ideas, and logical thinking. And we take the child through these 6 different stages and develop speech in that child. Now, another thing that is very important to remember is that in any kind of therapy, there is a window of opportunity. For development of speech, as you would know, the time between 18 months to 3 years to 4 years is actually the window where optimally speech can develop. So, giving maximum therapy during that time would be most effective for the child. Although the brain is plastic till the age of 6 years. So, of course, any kind of early intervention, we do say it should be till 5 or 6 years and continues beyond that as well. But it would be most effective if we are giving therapy before 5 years.
Okay, ma'am. It was good of knowing areas, 6 areas of speech development and brain plasticity and need for early intervention to get gains of window of opportunity. We will go on to next question, ma'am. How can I, as a parent, help in developing speech in my child?
So there is one of the fundamental things I believe in as a parent and as a developmental pediatrician is that the parents themselves are the best therapists because they are with the child 24/7 and they can give input to the child all the time. And I think training parents makes a lot of sense because it empowers them, and it makes them feel come from a position of strength where they feel they can do something for their child. So one of the things which I say very often is that you should be talking to your child like you would be talking to another adult whom you like very much. Of course, the level of language is different, but your expression, the kind of warmth that comes across, and your body language, all that is really important when you're trying to communicate to your child. Being at the level of the child is important. Making good eye contact, modeling language for your child is important. They say that children pick up language when the voice is high pitched. So women are naturally at an advantage because we have high pitched voices. So the
Yeah,
term
ma'am.
motherly came into a place where they said that it's the mother tongue or the language comes from the mother because children automatically pick up the sing song high pitched voice of the mother. But now, to be politically correct, we would call it parentese. So even to the fathers, we would say that pitch your voice a little high. I would just give an example, like if you just say that, oh, we have French fries, come and eat some, it will not make an impression on the child. But if you say something like, oh, look, we've got French fries, yummy, we got ketchup with it. So lifting
Yeah.
your voice and pitching the tone high makes a lot of difference to the child. So that is one thing that you can regularly do. That when from the time that your child is very small, you can start doing that. And Then giving your child choices is important. Even when the child is non-verbal, if you're giving them an opportunity to choose that, if you keep rice and chapati on the table and you ask your child which one do you want, and he can point and tell you which one he wants, or he can even do an eye point, which the one he looks at. So you're giving him an opportunity to
Yeah.
develop language very early. The same thing is with clothes. If he is had a shower and you keep two sets of clothes and point to them and say this one or this one. So even if he doesn't eye point, you congratulate him for trying to communicate every time. That is very important. That encouragement that yes, you did make an effort to come across to us or communicate with us is what builds the developmental the language in the child. And the other thing is that open-ended questions is one thing that builds language. That rather than telling him so you went to the shop, so you give him a choice. Did you go to the shop or to the park? So even a child who's speaking single words would say, I went to the park or I went to the shop. So you're giving him an open-ended question where he's
Open-ended
able to
question.
make a choice and take that. And other thing is that modeling language for the child. A lot of parents tell me that we keep asking them questions, but they don't answer. Obviously, if they don't have language, how will they answer? So I gave this
Yeah.
example in another seminar that if you see a flower, don't point at it and say, what is that? He won't know what to say. But you say, oh, look, that is a flower and that is yellow and it smells nice. So then he
Yeah.
already is getting a language in his data bank, which he can reproduce later on and produce that language. So you're putting that in his hard drive already. And I think having play dates with other children is also an opportunity for children to develop a lot of non-verbal as well as verbal communication. Just watching other children and imitating them is one thing that helps them. Another thing that you can do is commenting. Commenting is that you're watching your child playing and you say, oh, so you're having a party for the dollies, and the dollies are having cookies and they are having milk. And whatever your child is doing, oh, you're wearing such a pretty dress. So anything about the child or what the child is doing, if you keep commenting on that, the child is getting an input of language all the time. So I think there's no end to this. We can have another session
Yeah,
on this.
ma'am.
Get on to the next question.
The very good points, ma'am, which can be followed easily by parents to develop speech in their children. Next, and definitely we'll plan a session on this question once again, ma'am. Then we move forward to next question. Is that what messages would you leave for parents of kids with speech delay?
So I think a message of hope more than anything else. What I would say is that uh, I mean, in the worst case scenario, even if it is autism, I think what largely determines your child's prognosis is largely determined by how you handle it, your attitude. So that's it's interesting. But when I was doing my residency, my professor used to tell me that when you go on a round in the hospital, first look at the mother's face, because if the mother is looking happy, that means the child is better. So I think it's
Okay.
it's, it's absolutely the same kind of story with speech delay and autism, because the kind of mother and father that the child has, and the fact that they take it head on, that we are going to work with our child, we are going to do those 20 minutes twice a day, we are going to get those 40 hours of therapy for the child, we are going to travel across the world if it is required to get this child's speech. So that kind of commitment is required, that you would do anything to get your child to talk. And I'm not talking in the air. I've done it for my own child. My child had
Oh,
speech delay, and he still has a language processing issue to some extent. You cannot tell it now. But what I'm saying is that just having a vision and a dream that I'm going to be seeing my child talking, I think that is the big thing. And it's a lot of hard work, like for any parent. parenting a neurotypical child is hard work, and parenting a child with speech delay or with autism is also hard work. It's just different kind of hard work, and I think you should just take it in the right spirit, and things always work out. There is always the sun always comes out. Yeah.
Okay, ma'am. Thank you, ma'am. We will end the session here. For more details, you can contact Dr. Radha Rajpal, ma'am. She's a consultant pediatrician from Fortis Memorial Hospital, Gurgaon. Thank you. Bye bye. Signing off, Dr. Narendra.
Bye. Thank you, Dr.